If you're over 60 and finding that your erections just aren't what they used to be, you're not alone. Thousands of men experience this silent struggle, one that eats away at confidence, joy, and intimacy. But here's the surprising part. It may not be your age. It may not even be your hormones. It could be something far more basic, your grip. Yes, the way you grip yourself during stimulation may be sabotaging your performance without you even realizing it. In fact, many older men are unknowingly doing damage to the very thing they're trying to protect by using the wrong grip habits. Today, I'm going to expose the 7 most common grip mistakes men over 60 make that silently chip away at their erection, strength, sensitivity, and pleasure. And by the end of this video, you'll not only learn what to avoid, but also how to stimulate smarter, not harder. I'm Dr. Henry Carter, a men's health specialist, focused on helping seniors revive their performance confidence and vitality. Let's begin. Why grip matters more. After 60, most men don't think twice about how they touch themselves after all. It's something you've done your whole life, right? But here's what almost nobody tells you as you age. Your nerves become more sensitive, your circulation slows down, and your erectile tissue becomes more delicate. This means the same grip that felt great in your 30s might be doing more harm than good in your 60s. Think of it like this. If your penis was a young sapling in your youth, it's now more like a mature tree. It needs support, care, and precision, not brute force. There are 3 big changes after 60 that make grip mistakes more dangerous. 1. Reduced sensitivity. As testosterone levels dip, nerve sensitivity decreases. Many men instinctively squeeze harder to feel something, but this can create even more desensitization over time. It's like yelling louder at someone who's hard of hearing. It doesn't help. It only causes damage. 2. Slower blood flow. Blood vessels become less elastic with age. This makes it harder for blood to rush in and stay put. A poor grip can restrict flow instead of encouraging it, like stepping on a hose and wondering why no water comes out. 3. Recovery time increases. You don't bounce back like you used to. Recovery time takes longer, and if your grip is causing micro damage to your erectile tissue, you may be setting yourself up for a longer-term decline in firmness and responsiveness. And here's the kicker. Most men don't even realize they're doing anything wrong because these grip habits feel familiar. They feel normal. But normal doesn't mean optimal, especially when your body's changing. So let's break down the 7 most common grip mistakes that older men make, starting with the worst offender of all. Mistake number 1, the death grip. Let's talk about the infamous death grip. What is it? It's the habit of gripping yourself too tightly, so tightly in fact, that you're cutting off your own circulation and overloading your nerve endings. Some men do this subconsciously. Others do it intentionally because over time, they've lost sensitivity. And they believe squeezing harder is the only way to feel something. But here's what the science says. A grip that's too tight compresses the penile arteries, making it difficult for blood to enter and stay in the chambers that cause an erection. It's like pressing your thumb on a garden hose, nothing gets through. That short-term tightness may feel good for a second, but over time it trains your penis to only respond to unnatural pressure. So when you're with a partner, suddenly normal touch isn't enough. You can't feel as much. You can't stay hard as long. And your brain starts associating climax with one specific kind of pressure, your hand. Here's what the death grip does over time. Desensitizes nerve endings, making real intimacy feel dull. Creates micro tears in the skin and blood vessels. Conditions you for solo stimulation, only a key reason why some older men struggle with performance in bed, but not alone. It's not about being weak. It's about being smarter with your touch. Think finesse, not force. Precision, not pressure. Try this the next time you touch yourself. Reduce your grip by half, then half again. You may feel less at first, but your brain and body will start to rewire and sensitivity can come roaring back. Coming up next is another silent erection killer. Mistake number 2, dry grip without lubrication. Now let's talk about one of the most overlooked and yet most damaging grip mistakes, going in dry. Many older men skip using any form of lubrication during solo play. Maybe it feels messy, or maybe you've just never used it before. But here's the truth, dry grip equals friction, and friction equals irritation, sensitivity loss, and in some cases micro tears on the penile tissue. It's like rubbing leather without oil. Eventually it cracks. As we age, the skin becomes thinner, more delicate, and prone to irritation. Without lubrication, your grip creates constant resistance, with every movement overloading the sensitive nerve endings and wearing them down. Over time, this can lead to decreased pleasure, more difficulty achieving climax, redness or soreness post-activity, and even performance anxiety from pain or discomfort. But here's the worst part. Many men don't link their decreased sensitivity or delayed climax to dry grip. They blame their age, their testosterone, or worse, their relationship. But sometimes it's as simple as moisture. Think of lubrication as your ally, your amplifier. It allows you to reduce grip pressure while increasing sensation. It also encourages longer, more pleasurable sessions without the damaging effects of repeated friction. Water-based, silicone-based, or even natural oils like coconut oil, as long as they're safe for your body, there are many choices. The goal is simple: reduce drag-enhanced sensation. And just like that, one small change can unlock more feeling, better blood flow, and a better relationship with your own body. Now that we've tackled pressure and friction, let's look at something sneaky that most right-handed men, and yes, lefties too, don't realize they're doing. Mistake number 3, one-hand dominance. Let's be honest, most men have a go-to hand. It's automatic, it's comfortable, it's, well, familiar. And while there's nothing inherently wrong with favoring one side, doing so for decades without variation can actually backfire on your performance, especially after 60. Here's why repetition without variation leads to desensitization. Imagine wearing the same pair of shoes every day, walking the same path, putting pressure on the same spots. Over time, those areas wear down faster. The same principle applies to your grip. Repetitive use of one hand conditions your body and your brain to a single type of stimulation. Here's what can happen. Muscle memory takes over, making arousal feel mechanical, not exciting. The brain develops a fixed pleasure map based on one direction, one angle, one tempo. Your other nerve pathways, the ones you'd use during intimacy with a partner, don't get activated. Over time, this leads to difficulty climaxing with real-life touch, or even getting aroused at all. It's what urologists call masturbatory conditioning. You train yourself accidentally to respond only to a narrow set of stimuli, and when your partner comes in with a different rhythm, grip, or sensation, your body acts like, sorry, I don't know this language. The fix: switch it up. Use your non-dominant hand. Use both hands. Change the angle. Try different speeds. Close your eyes and make your brain work harder to reconnect with your body. You're not just breaking a habit, you're reawakening sensitivity and rebalancing your response system. Yes, it feels awkward at first, but awkward is good. It means your brain is learning again. And what it learns can lead to stronger erections, longer stamina, and much better connection. Next, let's talk about a mistake that turns a pleasure session into a high-speed race, and why that speed might be sabotaging your stamina. Mistake number 4, high-speed, no control. Let's talk about speed. Many men, especially those who are used to quick solo sessions, tend to adopt a fast, repetitive motion, almost like a sprint. It becomes a routine: fast strokes, short duration, done and dusted. But here's the issue. This high-speed, no-control approach is not only training your brain for short performance, it's actively weakening your erection stamina and nervous system control. Here's what happens with repeated fast-paced stimulation. You bypass the slower arousal phases that build a strong erection. You train your brain and pelvic nerves to expect rapid-fire stimulation. You risk developing performance anxiety with a partner who moves at a slower, more natural pace. You increase your chances of premature climax because your body's conditioned to hurry up and finish. It's like eating fast food every day, quick, convenient, but it destroys long-term satisfaction and health. And the more you rely on speed to get there, the more your system forgets how to respond to slow, sensual, real-world touch. Here's the deeper problem. Fast stimulation often comes from stress. You're doing it secretly, you feel rushed. You want relief, not connection. But relief isn't pleasure, and it definitely doesn't build intimacy or control. To reverse this, you need to slow down with intention. Think of solo time as a practice session, not just a release. Use longer strokes, pause midway, breathe deeply, and focus on sensation instead of climax. Imagine you're teaching your nervous system how to last, not just how to finish. And the result, you'll notice harder erections, more control, and a newfound ability to stay present during intimacy instead of racing to the finish line. Now let's dig into a surprisingly technical mistake, one that has everything to do with your blood flow timing and what most men get completely wrong after 60. Mistake number 5, ignoring blood flow. Timing, here's a mistake that slips under the radar because it has nothing to do with how your grip feels and everything to do with when you apply it. Most men don't realize that timing your grip can dramatically affect how blood flows into and stays in the penis. Get it right and your erection stays strong. Get it wrong and you might end up cutting it off before it even begins. Let's break this down. Erections rely on one key thing, uninterrupted blood flow. When you stimulate too early before your penis has had enough time to naturally fill with blood and apply pressure too soon, you end up compressing soft tissue instead of supporting it. It's like pinching a balloon before it's fully inflated. It can't expand properly. Here's what that looks like in real life. You start with tight grip before your penis is semi-erect. You interrupt the natural progression of blood flow. The tissues don't expand fully and the blood you do draw in gets squeezed out too quickly. The result, you plateau. You lose hardness midway. You struggle to maintain arousal. But the fix is simple: wait. Instead of jumping into stimulation right away, spend a few moments warming up. Let blood naturally flow into the area. Use soft touch, gentle strokes, mental imagery, deep breathing. Once you're at 50–60% erect, then begin light stimulation, gradually increasing pressure, but never squeezing like you're wringing out a towel. This simple tweak helps your penile chambers open fully and lock in that blood, leading to firmer, longer-lasting erections. Timing isn't just important in music and comedy, it's critical to your sexual health too. Slow is smooth, smooth is strong. Next, let's dive into a subtle but devastating habit, applying grip pressure in all the wrong spots and what it's doing to your erection quality. Mistake number 6, grip pressure in the wrong spot. Now let's talk about a mistake that's subtle, but seriously damaging over time: applying pressure in the wrong spot. Most men have a default area they grip the hardest. For many, it's the base of the shaft near the pelvis. For others, it's the middle, or they create a ring-like grip that blocks blood from flowing forward to the tip. And that's exactly the problem. You may be unknowingly creating a tourniquet effect, choking off blood from reaching the parts that matter most, especially the glands, the head of the penis, which is rich in nerve endings and responsible for intense pleasure and climax sensitivity. Here's what misplaced grip pressure does over time. Blocks full inflation of erectile chambers, reduces sensation in the head, creates a narrow, uneven shape, what some men describe as a soft tip or bendy penis. Can lead to discomfort or even pain if used long-term. Instead of applying pressure in one fixed location, the key is to move your grip. Vary the direction, use more of your palm. Gently apply pressure from the sides, not just top and bottom. Think about supporting blood flow, not restricting it. And if you're gripping tight at the base, thinking it helps you last longer, think again. It's a short-term trick that often leads to long-term circulation issues and incomplete erections. Remember, your goal isn't just stimulation, it's vascular support. Every time you grip, you're either helping blood stay in or pushing it out. So try this tonight. Use an open-handed approach. Imagine cradling, not clenching. Let sensation come from the surface area, not pressure points. You may be shocked at how quickly your body responds with more sensitivity and stronger performance. We've got one more mistake to tackle, and it might be the most common of all. Let's talk about what happens when grip becomes mindless, repetitive, and disconnected from pleasure. Mistake number 7, mindless habitual grip. This final mistake is the most common one, and possibly the most destructive, because it disconnects you not just from your erection, but from your pleasure, your body, and even your partner. It's what I call mindless habitual grip. You know exactly what I'm talking about. The late night routine, same hand, same position, same strokes, no mental engagement. It's not about pleasure anymore. It's about habit, relief, or even boredom. And while that might not seem like a big deal over time, it trains your nervous system to operate on autopilot. Here's what that does to your erection health. Detaches arousal from the brain, you're not mentally or emotionally engaged. Conditions you to only climax through one repetitive pattern. weakens your ability to get turned on by your partner or by new experiences, and ultimately dulls sensitivity because your brain stops releasing pleasure chemicals like dopamine when the activity feels routine or robotic. Your brain is the biggest sex organ you have, especially after 60. If you're not mentally involved, your body follows. And the result, less interest in intimacy, difficulty staying hard, a feeling like nothing turns me on anymore. But there's good news: you can rewire your brain, and it doesn't take long. Start by changing the setting. Don't rush. Use scent, sound, even touch in new ways. Focus on sensation. Watch your breath. Engage your imagination, not just your hand. Bring awareness into every movement. Pause. Listen to your body's response. This isn't just about performance. It's about reclaiming the joy of touch, the beauty of arousal, and the power of presence. And when you do that, everything changes. Erection quality, sensitivity, stamina. Even your emotional connection to yourself and your partner starts to come alive again. We've covered all 7 grip mistakes. But before we close, let me give you a few key takeaways and expert strategies I give my senior patients every day. Expert advice from a urologist. Now that you know the 7 grip mistakes that silently damage your erections after 60, let's talk solutions. Because knowledge alone isn't enough. You need actionable tools that work with your body's changes, not against them. As a urologist who's worked with thousands of older men, here's what I recommend to all my patients. First, retrain your sensory system. Sensitivity isn't lost forever. It's reprogrammable, but only if you stop overstimulating the same way every time. Try this simple routine for the next 7 days. Switch your grip hand. Use a lighter touch than usual, about 30% of your typical pressure. Add lubrication every time. Don't aim for climax, aim for awareness. Use slow, full strokes and breathe deeply as you go. This reactivates your sensory nerves and begins undoing decades of overconditioning. Second, prioritize blood flow before stimulation. Before even touching yourself, prime the area. Do a few light pelvic floor contractions like Kegels. Massage the inner thighs or lower abdomen to encourage circulation. Take a few deep breaths to lower cortisol and stress, which constricts blood vessels. When blood is already flowing, you're much more likely to get and keep a solid erection. Third, engage your mind. Pleasure after 60 is less about mechanics and more about mental immersion. Close your eyes. Visualize touch, connection, and warmth. Use fantasy or memory, not screens, to create excitement. Try sensual audio if it helps guide focus away from repetitive habits. This stimulates your brain's arousal centers and boosts dopamine, nitric oxide, and erection strength. Fourth, use stimulation as a diagnostic tool. Every time you touch yourself is an opportunity to learn. Ask, did my grip feel natural, or was I forcing it? Was I mentally present or just going through the motions? Did I feel more blood flow or less by the end? These micro adjustments build a new habit of awareness. And awareness is the foundation of performance, stamina, and satisfaction. Fifth, be patient with your progress. If you've been gripping the same way for decades, change will take time. But the results, improved hardness, sensitivity, stamina, and pleasure, are worth it. Remember, it's not about fixing yourself. It's about reconnecting with the man you've always been underneath the habits. Small changes, big impact, one day at a time. Now let's bring everything together in a final reminder that your grip can either be your downfall or your comeback. Conclusion, gentlemen, let's take a moment to reflect. For years, maybe even decades, you've developed habits that felt automatic. Your grip, your speed, your routine, it all became second nature. But now, after 60, your body is speaking a new language. It's not breaking down, it's just asking you to listen differently. And what it's asking is simple: stop squeezing. Start feeling. Stop rushing. Start connecting. Stop mindless patterns. Start meaningful touch. You've now learned the 7 most common grip mistakes that silently sabotage your erection health. The death grip: too tight, too numbing, too disconnected. Dry grip: friction over function, irritation over sensation. One-hand dominance: repetitive training that rewires your pleasure map. High speed, no control: a sprint that leads to early finish lines. Poor blood flow timing: squeezing before the body's ready. Pressure in the wrong spot: blocking what you're trying to build. Mindless habit: the slow numbing of sensation, connection, and desire. But here's the good news. Every single one of these can be reversed. You can retrain your body to feel again, you can reconnect with pleasure, and you can build erections that are not just harder, but more satisfying, more responsive, and more under your control. It's not about being young again. It's about becoming a better version of yourself now, smarter, more aware, and more confident. So the next time you reach for yourself, ask, am I doing this out of habit or out of connection? Am I chasing sensation or cultivating it? You don't need pills or pumps to get your edge back. You need presence. You need intention. And you need the courage to let go of what used to work and embrace what works now. Because after 60, intimacy isn't just about sex. It's about feeling alive again in your body, in your mind, and in your relationships. And that journey starts with your grip. I'm Dr. Henry Carter. Thank you for watching, and here's to stronger, smarter erections and a more powerful connection to the man you truly are.